So good afternoon, everyone. My name is Matt Gasecki, and I am the Community Outreach and Education Coordinator with NAMI Greater Cleveland. And welcome to Reimagining Crisis Response, Understanding 988. We are joined by Rick Oliver from Frontline Service, who will be providing this presentation. Just a few notes for you before we begin. Please do remain muted. We will have about 15 minutes for questions at the end, and I would ask you to please hold your questions until we reach that point in the presentation, as many of your questions may be preemptively answered by Rick's presentation, which will cover the first 45 minutes of our program. When you do have questions, please ask them using the chat box, and I will be monitoring that and selecting questions for as much time as we have at the end of the presentation around 12:45. And again, this is being recorded and will be available for viewing on the NAMI Greater Cleveland YouTube channel later this week. And I will also be providing you with a copy of these slides as well after this presentation. I want to start with a few words about NAMI Greater Cleveland. For those of you that may not be altogether aware of our work in the community, NAMI stands for the National Alliance on Mental Illness. It's a grassroots organization that was founded in 1979 by a group of mothers of children with mental illness. They wanted to create a grassroots movement to support a movement that would focus on education and support and acknowledgement for families affected by mental illness. NAMI is now the largest grassroots mental health organization of its kind and is represented by state or local affiliates in all 50 states. And NAMI Greater Cleveland is the local NAMI affiliate that serves Cuyahoga County. Our mission is dedicated to empowering those living with mental illness and their families to achieve a better quality of life by providing education, support, information and referral, and advocacy. NAMI offers support groups for people with mental illness, support groups for families. We have 8-week educational courses for peers and for families to learn more about mental health. We do extensive outreach in the community with different audiences like law enforcement, college students, middle schools and high schools, healthcare professionals, folks currently in the hospital, corporate groups, and more. We also have a helpline that is available Monday through Friday, 9 to 5, that can answer questions about accessing mental health or substance use treatment services in the county, as well as other community services and resources that may be supportive to people with mental health conditions. And finally, NAMI also supports advocacy in the sense of raising awareness about mental illness. NAMI is engaged at the state and national levels in research and legislative advocacy to make mental health a public health priority, to obtain more funding for mental health services, and also just to reduce the stigma around mental illness as well in community conversations. So that's NAMI in a nutshell. With that being said, I'm going to move us now towards the focus of our presentation, which is understanding 988. So I will hand it over to Rick Oliver to introduce himself and get us started. Thank you for joining us.
Thanks, Matt, and thanks to you and NAMI for inviting me out to talk about 988. I think it's a very, very exciting time in the country as 988 starts to roll out, and I'm hoping that my presentation will give you a little bit of information about what's happening and where we're headed. In not only in Cuyahoga County and Ohio and in the United States. Again, my name is Rick Oliver. I'm the Director of Crisis Services at Frontline Service, and in that role, I oversee a number of crisis and trauma programs, mostly including the Mobile Crisis Team, which for those of you who are joining from Cuyahoga County, I'm hoping that you know at least something about the Mobile Crisis Team, and I'm going to give a little bit of an overview about that, about the current crisis services, and then talk a little bit about where we're headed. But this slide basically is going to give you an overview of what we're going to talk about today and where I'm at. I'll revisit this slide at the end of the presentation as well. But these are basically the key points that I'm going to be focusing on. 2 Saturdays ago, July 16th, was really just the first step in transforming our crisis system across the country. No new services have been added. The only thing that changed was really 988 allows us a new and easier way for people to reach out for help. And I'll explain that as we go a little bit further. 988 is generating some additional funding to the crisis system across the country. Those funds are just now starting to reach the agencies. And so that's why no new services have really started. We're basically going to start building the system, but we started with introducing 988, the 3-digit number to contact crisis services when you need those services. We're hoping that this funding will be able to build out our crisis services, and that means also increasing our behavioral health workforce, not only for crisis services, but across all types of behavioral health services. There's a lot of people in need, and we need to be prepared to address those needs, and we need people to be there to help. One of the main points I'm going to say is that you may also want to continue to call, at least for right now, local crisis hotlines. We just heard this from the national people recently. And the reason for that is that 988 currently does not have a geolocation technology, which means that the calls, if you have an area code from 216 or 440 on your phone, it will go to the local crisis center that's answering those calls. But 7% of our calls come from phone numbers outside of that. And those numbers, if you call 988 from a different area code, or from a phone that has a different area code than 216 or 440, it's likely going to direct you to a center that's outside of this local area. So calling the local hotline it's still working. It's still going to be in existence. We're not changing the local hotline, and I'll talk a little bit more about that as we go further. Over time, we are hoping that people will call 988 instead of 911 for behavioral health crises. But in order for that to happen, there's going to be a lot more collaboration we need with 911 operators as well as law enforcement. I think we're pointed in that direction, and we're just taking the first step. We're not there yet, but that is the goal. And ideally, 988 is going to result in us having trained behavioral health workers responding to people in crisis instead of law enforcement, which hopefully will lead to better outcomes. And I'll talk a little bit more about that as well as we go forward. So I just wanted to talk a little bit about the current crisis continuum in Cuyahoga County. So Frontline Service is funded by the Adams Board, the Alcohol, Drug Addiction and Mental Health Services Board of Cuyahoga County, to provide the crisis services that are listed on this slide. First and foremost is the mobile crisis team, which consists of both the adult crisis team and a child response team. And I'm hoping that almost everyone knows that number. I'm not sure why that's doing that. It's maybe trying to move me along a little faster, but the 216-623-6888 is the local crisis hotline for Cuyahoga County. And each county has a crisis hotline. If you're outside of Cuyahoga County, it would be a different local number. And there also would be a different services available in each county. We are hoping that 988, as we go forward, we can develop services where services don't exist. Where we're lucky enough in Cuyahoga County to have a mobile crisis team. A lot of counties do not have that service. We also have a crisis stabilization unit, and many counties in Ohio and across the country do not have that level of service either. But Frontline oversees both the mobile crisis team with that 24/7 crisis hotline. There is an ability for a crisis team to come out to respond to those in crisis. We do a lot of screening over the phone to determine we have limited resources, only 1 or 2 teams working at a time. So we can't get out to see as many people as we'd like. We're hoping that, again, this additional funding that's coming into the crisis system will allow us to do more assessments, outreaches into the community to help people in crisis. We do in Cleveland have a police co-responder program. It is a pilot program through a federal grant that is also, the Adams Board applied for the grant and got it, and we're one of the crisis providers for that. There's one team in each of the 5 districts in Cleveland. They work about 40 hours a week, so they're certainly not covering 24 hours, 7 days a week, but it does give the ability at times for a mental health professional to be on scene when a law enforcement is called out to the scene. And we have seen some interesting results from that program. But again, it's a pilot. There's an evaluation component. We're trying to determine how helpful it is and whether it's worthwhile. And I like to think that early signs are that it is helpful. And the crisis stabilization unit is this 15-bed facility that people can go and stay at a voluntary unit where people can go and get some stabilization. So those services currently exist. There hasn't been any change to those services. Those are the services that Frontline and myself oversee. So through funding from the Adams Board, the mobile crisis team has been helping since 1995. The mobile crisis team has been in existence and really has helped many people in Cuyahoga County. In 2005, our service added the taking calls on the National Suicide Prevention Lifeline. So we've been doing that for over 15 years, and that's when the Lifeline started. And that's helpful to know because 988 is feeding calls into the National Suicide Prevention Lifeline. So we've been doing it, for 17 years, we've been taking calls. And so nothing, that's why I'm saying no services have changed. We've been doing it. It's just a different way of accessing that service. And just a quick look, in 2021, the mobile crisis team answered over 32,000 calls on the local hotline and an additional 7,800 calls on the National Suicide Prevention Lifeline. So just under 20% of our calls come through the National Lifeline. So we almost had 40,000 calls last year. We're at our current pace, we're going to easily pass that up this year, kind of unfortunately. And this is a slide that really talks about, and everyone who's signed up for this webinar knows these statistics or knows about them, that 1 in 5 Americans will experience a mental health illness every year. And many of those individuals, unfortunately, go untreated. Sometimes it's because access to services is not there. In 2020, there was approximately 1 death by suicide every 11 minutes in our country. We also know that suicide has been rising. The rates of suicide for younger individuals, 10 to 14, and also those 25 to 34, where it's the second leading cause of death. And just a local number, again, from Cuyahoga County in 2020, that's supposed to say 179 individuals died by suicide, according to our medical examiner's office. So both nationally and locally, there's a lot of people in need, and there needs to be services in place. And these are the crisis services that we're working on developing, that are there to help individuals in need. So this slide just gives you a quick overview. This is not my slide. This was developed by the National Suicide Prevention Lifeline. And it basically breaks down the percentage of calls, where the calls are going, the people in behavioral health need. So this was I believe this was in 2020, that between 2.5 and 3 million calls went to the Lifeline, the National Suicide Prevention Lifeline. Another 13 to 15 million went to local crisis hotlines. And then 24 million calls annually go to 911. And we're hoping that 988 works to shift this a bit. We need less behavioral health crisis calls to go to 911, which would typically warrant a law enforcement response, and we need to have those calls shifted over time to 988 and even the local crisis hotlines so that we can have a behavioral health response. Now we have to continue to add workforce and build out our ability to respond. Many people in crisis call 911 because they know someone's going to come quickly. And that's where our behavioral health system has to go. We have to get to a place where we can also respond quickly without law enforcement being present. And it's not really a knock on law enforcement. It is, we want people who are better trained to be responding. We want law enforcement to do what law enforcement's supposed to do. And we want behavioral health system to do what it's supposed to do and meet the needs of the people in behavioral health crisis. So we believe that 988, that there is hope through 988. We know that many people, if you go move around the country, people don't know how to access crisis services. And the number one goal of 988 is to make access to services easier, to have a 3-digit number that people can call. And whether people don't have to be suicidal. They don't have to be, it can be an information and referral call. It can be people who just need to talk to somebody. It can be people who are in crisis. We're hoping that we develop this into a one number for any kind of behavioral health need that people have. It is a 24-hour, 7-day-a-week free confidential support for people who are in crisis or in mental health distress or just need some information. The Lifeline, National Suicide Prevention Lifeline, again, has been in existence since 2005. These calls have been answered since 2005. And so it's proven that there's been studies done on the Lifeline calls, and they'll reach back out to callers afterwards and ask them if the help they received was beneficial. And the research has showed that people are less depressed, less suicidal, less overwhelmed, and more hopeful after reaching out for help. So 988 is really going to offer trained crisis counselors who can help. And again, this is kind of a repeat of that. It's lots of suicide, and we currently get about 25% of the calls we receive every day are related to suicide, people with suicidal thoughts, people with planning about suicide. It's something that is more common than most people think. I'd like to think that people who are on this webinar may be a little bit more in touch with the needs that are happening out there. That it is a concern, but it's a normal, and it's normal to reach out for help for those concerns for people in crisis. What's also helpful to know is that people can text to 988. I tried it just the other day. I typed in 988 and it brings up a text box and it asks you to read through a couple things, and you can get right connected to a Lifeline worker, a trained counselor, or you can be at your computer and you can chat to the 988 Lifeline. I'll show you some numbers in a few minutes about those services. We're looking for 988 to be a universal entry point. So no matter where you are in the United States, you can reach a trained counselor who can help. So this is a little bit of a busy slide, not mine, but this is where 988 came from. So way back in 2001, when Congress appropriated the funding to start the National Suicide Prevention Lifeline, it took about 4 years to get that up and running, but they had to create that whole infrastructure. And so by 2005, the calls going across the country were being answered by 100. I think there was 150 or so agencies that started. Now there's over 200 agencies that are answering calls, and that's continuing to grow. Now that we've added 988, we've added, we went from, I think, 17 or 18 crisis centers in Ohio to, I think we're up to 20 or 21 now who are answering the calls across our state. In 2007, they added the VA, the Veterans Crisis Line. In 2013, they added the chat service. The Disaster Helpline came along in 2015. And then in 2020, the FCC designated 988 as the new way to access this crisis hotline. And actually, the 1-800 number has not gone away. 1-800-273-TALK still is in existence. It's still going to remain in existence. People, if they're comfortable calling that, or maybe you got it programmed into your phone, you know, that's not going away, and nor is the local crisis hotlines going away. So we've also, they incorporated 2 years ago, they added texting to the chat capability. And so now the 988 does all three, phone, text, and chat. And so now we've gotten to July 16th, and we started that transition, and now we're answering calls on that line as well. So just a quick summary. This is an Ohio slide. Since 2005, we've been answering the calls on the hotline. The number transitioned, 988. Easy to remember number on July 16th. And this phrase that we're using is someone to talk to, someone to respond, and a place to go. That's where the system we're building. We want everyone to be able to reach out to someone and get connected to a trained counselor. But then there needs to be across the country people to respond to those in crisis, and developing places where people can go. And not always a hospital is not always the right place to be. There needs to be some other, like a crisis stabilization unit. And hopefully those resources are coming across the country in Ohio, but also across the country. So in order to do this, we know that we do have to create partnerships with law enforcement. We really do need to reduce the reliance on police. They are the safety net, and we know there are times when that doesn't go the way it should go. The police, we can't expect the police to be trained to know how to deal with everyone who's in a mental health crisis. There are some excellent police officers out, especially in Cuyahoga County. I've worked with many, but not all of them, and they haven't gone through the training that people on the crisis hotline have. They're not expected to. There is some training. There's a CIT training that's done by the Adams Board, and there's thousands of officers in our county have been trained. But even that doesn't prepare them to deal with the behavioral health crises that they come in contact with. And so their default many times is take someone to the emergency room because they know someone, you know, they can respond, they can transport, they can get someone to a safe environment where someone can do an evaluation. But many times that's not the right disposition that's needed. Many people should stay at where they're at and get the services they need, as opposed to being transported to an emergency room. So again, this isn't necessarily something we can promise today, but this is where we're going. This is where we are building the system, and 988 is that first step. And so we're taking less people, hopefully, to the emergency rooms, which also helps them. You know, that we don't need to have, if someone doesn't need to be in an emergency room, we don't want them there. And you know, no one enjoys a trip to the emergency room. Only when you need to be there is really the best time to be there. So we're really hoping to better the behavioral health system needs to be prepared to meet the needs of people who are experiencing a crisis in a way that reduces stigma and encourages people at risk to reach out in the future. So, as I said, there's over 200 independent crisis centers who are now answering these lifelines across the country. Most callers are helped through the research we've done. And actually, there's a number over the last 12 months, the Lifeline has fielded over 90,000 contacts in just Ohio alone. So the Lifeline is being used a lot. So here is just a rough breakdown. This came from the Lifeline. In fiscal year 2021, the Lifeline received about 3.6 million contacts. When you call the hotline, you are given an opportunity to press 1 if you're a veteran, press 2 if you speak Spanish, or remain on the line, and you'll be connected to the local crisis hotline. It's helpful to know that in Ohio, we have built and actually I'll show you a map in a few slides, that there is a primary center, a backup center, and then another backup center. So if the first center can't answer the call should, the system is set up so that the call rolls to the next center who's backing that center up. So for Cuyahoga County, Lorain County is our backup, and Lorain County, Cuyahoga County is the backup for Lorain County. So there, and that happens all across the state. And then there is a statewide backup who is if neither one of us can answer the call in a timely way, the call should roll to the statewide backup center. But this also shows you the number 2.4 million calls, 1.1 million chats, and 0.1 million texts. They just started doing the texting, so that's relatively new. We do believe that over time, the texting is probably going to take over and be more popular, more than even the phone calls. It's a very useful way to field requests for services. Our frontline is answering both the texts and the chats as well as the phone calls. So this is a slide that I borrowed from somebody. This kind of shows you what we feel is happening in our crisis continuum. A person in crisis calls the hotline, and about 80% of the time, the crisis is resolved over the phone. That is true at our center as well as the most places across the country, especially those who have a mobile crisis team. It's different if they don't have a mobile crisis team, but for those who have all the services that Cuyahoga County has, so that means 20% then are sent to the mobile crisis team for an in-person response. And of that 20%, 71% of those are resolved in the field, not going anywhere. They don't need to, we come out to the home. Many times people are given a doctor's appointment or linked to other services. And then there's a percentage of people that do need to go someplace, that do need to go maybe to a crisis facility. Some people need to go to a hospital. We do believe that a hospital is a last resort. That's the most restrictive. So that's not where we're going to look first. We're looking for how can we maintain the person in crisis in their community, in their home environment. That's the first thing. If they maybe need to go to a crisis stabilization unit for a couple of days, that's an option. And a last option would be somebody who might need to go to the hospital. And we're trying to, again, minimize the amount of time that law enforcement's involved. But again, sometimes it's necessary. Someone who needs services and might not be agreeable to those services occasionally, but it really needs to be really as a last resort. So here's the coverage map I mentioned before. On the left side of the screen was the coverage prior to earlier this year, and some of the counties in the gray were not covered even on the National Suicide Prevention Lifeline. So now the map in the middle shows you, it's a little bit small, but it shows you the crisis centers. The stars are where the crisis call centers are located, and it gives you the primary agency for each of those areas. And they did it based on call volume. So Cuyahoga County and Franklin County, Hamilton County have very large call volumes because of the population. So they're kind of to themselves. Other call centers take on more than one county. Actually, Cuyahoga County and Franklin County kind of go back and forth as fielding the most calls on the National Lifeline in the state of Ohio every month, because we do monitor that every month. So you kind of see that. So this was created by the Ohio Department of Mental Health and Addiction Services, and they're trying to put in writing the difference between 911 and 988, like when to call 988 and when to call 911. And again, this is kind of small. In fact, I can't necessarily even read it myself. But hopefully when you get the printout, you can make it bigger and you can see. So you might be able to see, and basically your people who are having any kind of medical emergency, anybody who's having any kind of the immediate danger to themselves or anybody else, that's when 911 is needed. And people who are, thinking about suicide or even talking about suicide, people who are depressed or having drug and alcohol problems or having depression, those calls could come to 988 to see if there is a non-law enforcement response that can happen to get the right services to that individual. So again, this is Ohio's ideal crisis continuum, that there's a way to connect to people, there's a way for people there's a response, there is a stabilization, and that helps people thrive. And so we want services to be accessible, to provide that support that people need, and really get people stabilized so that they thrive in wherever they need to be. This is a little bit, so their connection, 988 is the first piece of that, but there's also the local hotlines, the crisis text line. There is an Ohio Care Line. I'm not sure how many people know about that. That came about, Ohio developed that when COVID started. It was a COVID care line initially, and then Ohio kept their care line. That also rings to the crisis centers across the state. So 988, you're calling 988, you're reaching the same individuals and receiving the same level of care. So there is the gambling helpline. I know that Matt mentioned the NAMI helpline. There are helplines across the state that are helpful. Responding is both the community mobile crisis teams and co-responder teams that do exist here and there across the state, but they do exist in Cuyahoga County. The mobile response stabilization service for youth is coming to Cuyahoga County. That will be coming soon. I don't want to say too much more about that because it's maybe not up quite ready, but that's going to be a very valuable resource in our county and other places across the state. Crisis stabilization units and respite care, behavioral health urgent cares. I know that there's some movement in Cuyahoga County around behavioral health urgent cares. Again, another valuable resource that we have in Cuyahoga County that's coming, just starting. And so we're really looking for people to thrive in, there's a lot of people that have mental health issues, but people can have those issues and still thrive in school and house, employment. So again, our short-term goal is to really strengthen and expand the Lifeline infrastructure, and to improve access to care, improve access to the crisis hotline. The long-term vision is to build this robust system of care across the country, anywhere in the country, so that wherever somebody is, they can get the appropriate services that they need. Oh, I did a little bit of number crunching for the last couple of weeks. So this is, I'll try and explain this a little bit. So on the national hotline, this is just Cuyahoga County from Frontline. This is our call volume. In Cuyahoga County on the national hotline, from January until July 16th, we were averaging about 23 calls a day on that national hotline. During the week leading up to, so the July 16th was a Saturday, so the week leading up to that, we did see an immediate increase during that week. We were getting 42 calls a day on the hotline, on the national hotline. And this last week, the week of 7/17, we were averaging 41 calls per day. So just about the same, but you see it's almost double, 988 almost doubled what calls we were getting on the national hotline. And just to show you from the total call volume, so this is the local and national hotlines. Again, prior to July 16th, we were getting about 127 calls a day. And in the last couple of weeks, we've been over 150 calls a day. So 988 has made an impact in our call volume, an immediate impact in our call volume. And it has done that elsewhere, not everywhere. I had a state call last week. Some centers were not reporting much of an increase at all, but in Cuyahoga County, there was about that 20 20 call increase, 20 to 25 call increase on our crisis hotline. So the calls from the national hotline typically are about 18% this year. I showed the slide earlier with 19% of our call volume. In the last 2 weeks, it's been about 20%, 27% of our call volume. So it has shown an immediate impact. We've been able to answer the calls that have been coming in. There have been several calls that have been calling and just kind of finding out if it worked, if and what the service was. Not necessarily people in crisis, but we did get many of those as well. And hopefully those that called found the help they were looking for. So this is the slide I started with. I just want to go over it one more time and think if I caught most of these points. Again, the Saturday, July 16th was really just the first step in this transition. And we haven't really added new services. So, there isn't anything new except for a new way to connect to the National Crisis Hotline. And we are really expecting the funding. We do know that there is funding coming. I should have mentioned a little bit. I saw someone was reporting that the centers are now getting, or the funding is at least 10 times more than what it had been coming from the federal government to the states. So that's significant, and that's what the centers need in order to develop their services and to increase their workforce to meet the demand that we expect will happen over time. We think that the call volume will continue, and hopefully the calls will shift from 911 to 988. That's the goal. We would like to see less calls going to 911 and more coming to 988. Again, a point is that it's a good idea to maintain your local crisis hotline knowledge of that number and call that number, because you might get directed elsewhere in the state, or maybe even in the United States. If you've got an area code that's outside the United States, calling 988 might send you to that wherever that area code is located. And our goal is really that 988 will result. This is the transition, the transformation of our behavioral health crisis system is starting, and building not only the workforce, but also the additional services we need across the country to help people in crisis. As my last slide, I heard someone say that Hope has a new number. It's 988. I kind of liked it, so I stole it. Feel free to use it. I think that really it's going to be, as we move the system along, it's going to be really transforming the crisis system and really the behavioral health system as we know it. So I think I'm at the end of my presentation, and we'd be happy to answer some questions.
So thank you so much, Rick. A couple questions that we have already. Feel free to add your questions in the chat. A couple questions that have come in already. Do you have any idea when 988 will use geolocation technology? Is there any plan on that?
That's a great question. We have been told that it's not going to happen in 2023. So they don't know yet. They're working on it, and I think it just is a technology thing that's certainly not something they can flip a switch on. I think they have to really do a lot of work to get that set up, but they are hopeful that 2023 will bring us that geolocation component of the 980 system.
And another question, this is more about accessing these services in rural areas. You had a slide earlier that was indicating the crisis centers that are responsible for each county in the state of Ohio. Does mobile crisis only serve residents of Cuyahoga County? Can people outside Cuyahoga County be using the frontline mobile crisis number? What's the story on that?
Sure. So the mobile crisis team, our crisis services are funded by the Cuyahoga County Alcohol, Drug Addiction, Mental Health Services Board, and they are intended for people in Cuyahoga County. So we don't leave Cuyahoga County. If someone comes into Cuyahoga County and is in crisis, that typically happens at a hospital, although it could be someplace else. We do assess people who are in crisis, who are physically in Cuyahoga County at times, but we don't leave the county. And I have been on planning meetings, statewide planning meetings about 988 for over the last year. And luckily, the Ohio Department of Mental Health and Addiction Services is very aware of the disparity between counties, between the resources that each county has. Again, there were places in Ohio a year ago that having a even getting someone to answer a crisis hotline call was challenging. So 988 has taken care of the first step, is a place to call, a person to talk to and get connected to. That's the first step. So then the next step is, can we build a system that can respond adequately to those individuals' needs? And a place to go is the next step. And that's where that funding is coming. That's what the funding is meant to do, is to build out those other levels. We did that first step, so at least someone has a place to call and talk to someone. We do have resources. Each of the call centers, they are building a resource directory, a statewide resource directory. So if we get a call from somebody and they're down in Wood County or Butler County or another county, we should have a resources that we can at least provide. But there's no question that the resources do differ from county to county, even counties very close to where we are that do not have mobile crisis programs that can respond. So the state's aware of that. They are working to build those. I have personally talked to a number of county Adams boards across the county about how we did our mobile crisis team. I actually have been here since 1995 when Frontline started the mobile crisis team. So I have a little bit of history of building up and starting the crisis team. I know that there are teams there's conversations about building teams, and there are some counties that are building up those teams as we speak.
I want to scroll up a bit here to a question about, are you able in any way to address concerns about mobile crisis units that are already experiencing difficulties in responding in a timely manner, and now receiving even more additional calls through 988? Can you address any of those concerns?
Sure. Yeah. I mean, that's a concern for us in Cuyahoga County. We respond to as many people as we can with the staffing we have. If we had more staffing, we would respond to more people. So we're using the resources we have, and we are hoping that we can add staff to respond to more people. So it's happening in Cuyahoga County. We're fortunate to have a crisis response team, but it could be more responsive. We kind of talk about, and I've heard this across the state as well, a difference between emergency services and crisis services. Emergency services are people who need something like in the next 15 minutes. Crisis services are people who need something in the next couple hours, maybe same day type of services. That's kind of the definition we have historically used, because we've never had staffing to respond across the the entire Cuyahoga County to everyone who needs a service. So it is something that I'm hoping that 988, the funding that's going to follow 988, will work to build these services. It's not going to happen today or tomorrow, but it is coming. And I think that we'll see that change, but it's going to take a little bit of time.
Thank you. Other question is, what would happen if someone from Lorain County, for example, called the Cuyahoga County crisis line while in Lorraine? Are they transferred to the appropriate agency?
We would likely do a warm transfer. We have been working on that system across the state of Ohio. The warm transfer is basically, you're on hold and we call and do it like a three-way call and talk to the person in Lorain County. So we are trying to facilitate those warm transfers a little bit more, not hanging up and saying, here's a number, call this number. It's more of a, let me connect you to the crisis line in your area. That's the direction we're going. We should be able to do that right now. We've been working on that, and that's what what we've been meeting about for the last year is really building a statewide system. And Ohio's been very proactive about creating a statewide system that is responsive and really links the services in a way that we hadn't before. We had, all the crisis programs across the state really didn't have a lot of understanding of what services each one of them offered, where they were. And so our meetings over the last year have really, we've become very familiar with each other and are able to collaborate in services a lot easier now.
Another question is how much of the 988 calls are expected to be related to substance use or addiction crisis? Is there any information on that?
Another great question. There has been not as much emphasis on going even back to 1995. We were started as a mental health hotline, and the national hotline was a suicide prevention hotline. So those are both pretty specific and don't really speak to alcohol and drug addiction. The 988 is supposed to push out more education around the appropriateness of calling 988 for not only mental health, but also chemical dependency related calls. We have seen an increase here at Frontline. We have talked a little bit more about it being a behavioral health crisis hotline than a mental health crisis hotline. And 988, I think, is going to make a big difference. I haven't seen any projections on what they think as far as numbers, but I've heard that they are looking forward to more people with substance abuse issues calling 988 and getting linked to the help they need as well.
Can you give some examples of some of the short-term facilities in Cuyahoga County where a person may be placed after, you give that timeline of the call to crisis, the crisis line, the mobile crisis team responding, and then possible placement? What are some of the places in Cuyahoga County where a person might end up?
So the first place that we think of, because Frontline operates it, is the crisis stabilization unit, which is, again, it's a 15-bed facility. It's been in existence for 30 or 40 years. Frontline has only been operating it since 2012. But it is a place where someone can go for a few days and get that 24/7 support and get some stabilization if someone needs to if they need something more than just being at home and they don't quite need a hospitalization. And we do know that a lot of people go to the emergency room because they have mental health issues, and the hospital will do an assessment and they have to meet the criteria for, if just because you want to be admitted doesn't mean you're going to get admitted. You have to meet the criteria for admission. And many times someone is turned away after being assessed in the emergency room. The crisis stabilization unit was meant to be that in-between place between staying in the community and staying in a hospital. So it's a valuable resource. The other place that is a relatively new resource is the diversion center that was initially created for law enforcement and a very valuable resource for law enforcement when they didn't want to take someone to the emergency room or to jail, that they could take someone to the diversion center and keep them from jail. So that's been developed, and just in the last year, they have opened up the diversion center to other referral sources, such as a family member or a friend or the client themselves, the individual themselves calling can make a referral. Those referrals do come through Frontline, so an individual would have to call. You could call 988, or you could call the 623-6888 number and talk to the person on the other line about do I meet criteria for going to the crisis stabilization or the diversion center.
Another question is who is responsible for answering these crisis calls at Frontline? Are they paid staff? Are they volunteers? What's the story on that?
We currently do not have any volunteers. They're all paid staff. We have two levels of staff. We have licensed individuals who have either a counseling license or a social work license. And then we also have another level of staff who have bachelor's level and then significant training that we provide to answer the crisis hotlines. And that's very typical across the state and even across the country. The majority of staff are paid. A short time ago, there was a healthy percentage were volunteers. There are still volunteers that take calls in Ohio and across the country, but there is a move towards more paid staff and staff that have gotten even a license. And we use the staff who have the counseling or social work license are the staff that do go out and do assessments. Anyone who goes out and does that face-to-face assessment would need to have a license. So those staff are used in that role as well as answering the crisis hotline.
Thank you. So those are all the questions so far. I put a few links in the chat. I put the link for Frontline's crisis stabilization unit, as well as the link to more information about the diversion center, as those are two important resources to be aware of in Cuyahoga County, since that was really important that Rick mentioned both of those. I am also putting again in the chat the link for the evaluation for this presentation. It's anonymous. Demographic questions are optional. Should take 2 minutes to complete. We really appreciate your honest feedback about our programs, their usefulness to your work or your personal life, your everyday life. We do have a few more minutes if there are any final questions, but otherwise, just make sure that you click that link to the SurveyMonkey link in the chat, and open up the survey and complete that for us. That would be much appreciated. So I'll just leave another minute in case we have any more questions. I'm sure this has been very helpful. This is probably one of our more well-attended programs this year. Definitely something that people have a lot of interest and questions about learning this new resource and how it's working. Like I said at the beginning, I will make sure that you all receive a copy of these slides, some very important information in there, especially the slide, in my view, about with the legend, the map of Ohio, and the legend of agencies that will be fielding these calls, or which crisis center serves which counties. So thank you so much for joining us. I just see lots of thank you for this presentation in the comments. So thanks again, Rick, for generating your time and expertise to educating our audience about this topic. And I guess I can say enjoy the rest of your day in this beautiful weather. Thanks so much.
Thanks, everyone.
Bye.